been very healthy my whole life. So to have words like tumor applied to something in my body, it's pretty shocking and frightening.
There was just a lot of uncertainty, and that uncertainty made me very fearful, very frightened.
Our internist said, you need to go get an MRI, and she referred me to a neurologist.
Marylen only had one sign, which was a seizure. She had been put on anti-seizure medicines by a neurologist up in Maryland, had imaging that showed a small lesion that they weren't sure what it was. The final diagnosis was a WHO grade 3 astrocytoma. What that means, it's a moderately fast-growing primary brain tumor. During the first appointment with Marylen and her husband, they were definitely nervous.
It was clear from the moment he walked in the room that he was exactly who had been delivered into our life. He's extraordinary.
The plan was to do a biopsy, and now the question was, can we safely do that without causing harm?
Let's put our headsets on and we can fly you through your own brain.
In my opinion, the virtual reality 360-degree system was pivotal to planning Marylen's case.
What we're going to do now is fly into the brain. It uses flight simulation technology that no one's really used before. So this is the mass, that's the tumor that we were biopsying.
The surgical theater 360-degree VR technology allowed me to better explain to Marylen her condition during the consultation. It allowed me to show her her brain and show her where this mass was and how we would get there safely. We're giving like a mini anatomy lesson, and it's just another way of getting a patient comfortable with the fact that they're going to have to undergo a major surgical procedure.
If I'd had any stress about it before, it was gone.
The good news from how we planned this surgery was we removed greater than 80, perhaps even 90% of this mass. We sent it to her pathologist. In the operating room, she went to the ICU. Everything looked fine on a post-op CAT scan. She went home the next day.
I was overjoyed.
I'm absolutely certain that the only way he was able to do this resection and get 80 to 90% of the tumor out was because of the mapping exercise that he was able to go through to get to the right place in the brain safely with the technology. I feel so strongly about it that I think that it should become a standard of care for people who have brain tumors.
She's doing very well. She's excited about getting back to life, and she's experiencing life right now. I'm excited for the future that she has.
I just remember having a feeling of overwhelming gratitude. I felt like I was in the right place at the right time.
We couldn't have asked for anything more.